More than 200 people in 14 states have either died or shown symptoms in an outbreak of rare fungal meningitis linked to contaminated pain injections, federal health officials said Sunday. 15 people have died. The Centers for Disease Control and Prevention said 203 people had meningitis, while 2 had infections in their joints. The CDC has also published its first case report of the outbreak, which began when a Tennessee doctor diagnosed a patient with fungal meningitis on September 18, nearly 6 weeks after getting a steroid injection for back pain. The CDC says 26. Thank you for trying verbose. This recording will go away once the product has been purchased. Of the patients have a confirmed fungal infection, and all but 1 are infected with a type of black mold called Ixohilum. It's never been known to cause meningitis before, although it's common in the environment and can cause sinus and eye infections. One patient has Aspergillus, another fungus that occasionally can cause meningitis if injected into the spine, as well as other infections. Both grow slowly and don't cause the classic symptoms of meningitis. Early in this outbreak, many patients with meningitis had only a few mild symptoms, the CDC and state health officials say in thank you for trying verbose. This recording will go away once the product has been purchased. Their report. Worse, treatment can last months and requires infusions of 2 strong antifungal drugs, the CDC says. Right now, no one knows how long patients will have to be treated, and the drugs themselves can cause severe side effects such as kidney damage. As many as 14,000 patients may have been given the tainted steroids. Early identification and treatment of patients with fungal infections might reduce the risk for serious complications, such as stroke or death, CDC says. Meningitis is an inflammation of the spinal cord or the membrane surrounding the brain. It's extremely serious when thank you for trying verbose. This recording will go away once the product has been purchased. Caused by bacteria, viruses can also cause meningitis. Fungi and parasites cause it more rarely. Most of the patients in this outbreak have complained of headaches. FDA urges patients who believe they received an injection or other product compounded by NDCC to remain vigilant for the signs and symptoms of infection, including meningitis. The signs and symptoms of meningitis include fever, headache, stiff neck, nausea and vomiting, photophobia, sensitivity to light and altered mental status, the Food and Drug Administration said in a statement. State and federal health officials are trying to find out how and why. Thank you for trying verbose. This recording will go away once the product has been purchased. Massachusetts Pharmacy, the New England Compounding Center, managed to distribute so many vials of the steroid, called methylprednisolone. It can be injected into the spine or joints such as the knee or ankle to treat pain. Massachusetts state health authorities say it appears NDCC broke regulations in distributing the high volume of drugs. All of the cases so far have been linked to 3 affected batches of the steroid, although all of NDCC's products have been recalled. The sister company, Emeritus, is also being investigated. Based on the business relationship between NDCC and Emeritus, FDA and the Massachusetts thank you for trying verbose. This recording will go away once the product has been purchased. Board of Pharmacy launched a joint inspection at the Emeritus facility in Westborough, Massachusetts on October 10, 2012, the FDA said in a statement. As part of our efforts to protect the public health, FDA is investigating whether certain aspects of compounding practices and facility conditions observed at NDCC may be present at the Emeritus facility. FDA will review whether Emeritus has procedures and facilities necessary to safely produce and provide sterile drug products. At this time, there is no known contamination of products produced by Emeritus.